Well, hello everyone. For those of you who don't know me, my name is Brad Forbes, and I am the Director of Public Policy for the Washington State chapter of the Alzheimer's Association. And I'd love to welcome you to our Public Policy Town Hall for 2023. I have my colleague Nicholas Hart with me to also present, and I will give him a chance to introduce himself momentarily. But first, I just want to say that we really appreciate all of you being here today for an update on the work we've been doing with our elected officials to better serve those affected by Alzheimer's and all other forms of dementia here in Washington State. We will begin today's meeting with a review of some of the policy work that we've been doing at the federal level, followed by an update of some of the goings on at the state level. And then at the end, we will give an opportunity for everyone to ask any questions that you may have. And so with that, I have just a couple of housekeeping items before we get started. If you are having any trouble seeing or hearing us, please know that the problem may be on our end for all that we know. And so go ahead and use the chat function at the bottom of your screen, and we will do what we can to help rectify the issue. Also, as I mentioned, there'll be an opportunity for Q&A at the end. And so if you can use the Q&A function, if you have any questions throughout the presentation, use the Q&A function at the bottom of your screen, and we will track those questions and then go through them at the end of the presentation and get through as many as possible with the time that we have. And so with that, I would like to hand it over to my colleague, Nicholas Hart, to introduce himself and talk a little bit about the work we're doing on the federal level. Go ahead, Nick.
Thank you, Brad. For some reason, I'm not able to start my video. It says that it stopped, but if people don't mind seeing my face, not seeing my face, that's totally fine. But maybe in the meantime, I'll just jump right in here. So good afternoon. And oh, okay, perfect. Thank you, Brad. Okay, great. So good afternoon, and thank you everyone for your time in joining us today. My name is Nick Hart, as Brad mentioned, and for those of you who don't know me, I work on federal or congressional policy with the Alzheimer's Association's Washington State and North Idaho chapter. Today, I'd like to provide a brief overview of our accomplishments when it comes to our work with Washington's 10 U.S. House members and 2 senators, how we've made this progress, and to provide a preview of our work this year with Congress. So next slide, please. So first and foremost, I want to highlight how consistent the engagement of our advocates has been throughout this past year. You all stayed committed to making sure these members of Congress kept those with dementia and their caregivers near the top of their agenda through some seriously challenging times. And I want to thank you from the bottom of our hearts for not pumping the brakes. During the pandemic, you, I'm sure, will recall that for a period we operated completely virtually. This was the right thing to do in terms of protecting those we serve from COVID, but that's not to say that it wasn't a challenging transition. What's more, you all made the transition back to in-person engagement as soon as it was relatively safe to do so. It goes without saying that COVID and January 6th, as far away as they may seem, were significant events that seriously affected the way Congress does its business up to this point. We are very proud to say that progress towards our agenda and the people we serve didn't slow down at all during this time. And here I'll go through a host of accomplishments that we're proud to report back to you on, beginning with the continued engagement of congressional offices. In Franklin and Pierce County, for example, our chapter conducted community forums inviting feedback from community members affected by dementia on their unmet needs. We're proud to say that members of Congress representing both counties sent their staff to listen in on those needs and interact with constituents in attendance. And during the last year, we also kept up on regular in-district meetings with congressional offices and their staff, keeping them apprised of new and changing Alzheimer's priorities in Congress. Without requesting too much of their time to meet, our advocates stayed consistent in making sure we were identified as the organization with the best information on all things Alzheimer's. We also conducted successful Hill meetings with almost all of our Washington delegation during our annual advocacy forum in DC. Our advocates also pressed on with the virtual action alerts that we send out. For example, when a key vote is coming up in a committee that one of our members sits on, we had thousands of interactions last year. Members of Congress heard you loud and clear and year round, reminding them to keep our priorities moving as best they can. So thank you, first and foremost. And on to the next slide. This is pretty exciting too. We had a rally at the White House, which was awesome. You can sort of see it here in the back of the photo on the right. And the selfie on the left are Karen Merez and Janice Jasinski. Janice is in the back there holding the sign. You two may even be on this call. You do such excellent work. I just, thank you. They maintain really good relationships with Representative Schreier and Representative Marie Gluesenkamp Perez, respectively. You all may remember back when Aduhelm was the only treatment available that might actually slow the progression of Alzheimer's in those who have it in the early stages. That seems like ages ago now that we've seen another treatment approved by the FDA, with more likely coming in the future. At that time, we put a lot of pressure on CMS, and that's the Center for Medicare and Medicaid Services, to provide access to all newly FDA-approved Alzheimer's treatments and give those persons with dementia who use Medicare a chance to have more time with their loved ones. We're still negotiating with CMS on this. We know that many more treatments will be approved by the FDA and made available in the future, and we will continue pushing for their access to newly approved treatments, those who need them. So hundreds of advocates went to the White House lawn during our forum in DC to call on President Biden's CMS to fully cover those treatments. More time with our loved ones was definitely the theme of the day. As one advocate with dementia put it in his speech, I'm not asking for a miracle. All I'm asking for is a little more time. I'll go ahead and tell you, too, that I have a close friend who works in President Biden's administration. I had dinner with them that very evening after the rally, where they mentioned, unprovoked to me, that the White House heard us loud and clear on the lawn that day. So that is a great example, Alzheimer's advocates, of the fact that your hard work is working. Next slide, please. We also had some great interactions on social media throughout the year. As members of Congress increasingly adopt social media tools, it's important that we stay consistent in making sure they receive our messaging through social media as well. And during this time, our advocates were also keeping steady with regular media and social media outreach. To the right here is an example of a letter to the editor penned by Bruce Holroyd, our ambassador to Rick Larson, Congressman Larson. And to the left here is a great example of a tweet by Peter Newbold after he met with Senator Maria Cantwell earlier this year. Senator Cantwell shared during that meeting that she has a close personal connection to Alzheimer's disease and her family. The senator shared with him that she had a close connection to dementia, and in her words, was willing to do anything to help on the issue. So Senator Cantwell has a very large issue portfolio reflecting her tenure of many years in the Senate. And given this, it has been a challenge increasing our issue profile with her. So it's a very big deal that she shared her connection to Alzheimer's with us in this way, that Peter got this meeting. And we look forward to building on our relationship with her. In fact, if we can go to the next slide, I've got some good updates to share on both of our senators. Senator Patty Murray, our senior senator, moved up to chair the Powerful Appropriations Committee. Before her move to appropriations, she chaired the Senate Help Committee, where she worked hard across the aisle to include a large increase in federally funded home and community-based services. It's important to note that this was not ultimately included in the version of that bill signed by President Biden, which was very disappointing. But it's still a big deal because Senator Murray garnered strong support for this HCBS increase, which will hopefully establish this kind of caregiver supportive funding more permanently as something the Senate might want to take up. It's very exciting because when we talk about HCBS, we're talking about doing more to keep people in their homes as they age. And we all know the vast majority of people surveyed want to, unsurprisingly, they want to age and pass away in their homes if possible, should they receive a terminal diagnosis such as Alzheimer's. Patty Murray has also been highly instrumental in the consistent research funding increases we've received at the NIH. For years, we have had an outstanding working relationship with her, and she works hard on behalf of people affected by Alzheimer's disease. Simply put, if we didn't hit the Alzheimer's research funding levels that NIH scientists request and that Patty Murray has led in fighting for, we might not be in this new era of treatment today. Her leadership is a big deal. And again, she now chairs the very powerful Senate Appropriations Committee. I definitely consider that a win for our cause. Next slide, please. As well, I want to mention our ambassador to Representative Rick Larson, Bruce Holroyd. I mentioned him earlier. He's really taken our relationship with Representative Larson to a whole new level. Representative Larson serves a lot of veterans in his district and as such is highly interested in veteran issues. There has been a similar challenge with him to that of Senator Cantwell, I would say, respectfully. He's been there a while, has some seniority, and is very busy with an already existing issue portfolio. Bruce regularly engages Representative Larson and his office, often from the angle of supporting veterans with dementia. In doing so, we're encouraging Representative Larson to co-sponsor and support legislation that helps vets and the broader base of people living with dementia. So this is a great example of how to overcome the obstacle of a member's busy schedule. And Bruce, if you're on the call, thank you for your excellent work there. I also want to say thanks to Russ Wing. He served as our ambassador to a relatively new member of Congress, Representative Marilyn Strickland, and he's done great work to forge a relationship with her as a member completely anew. Russ kept up his outreach, met with Representative Strickland's staff, and we're proud to say that she will join the bipartisan congressional task force on Alzheimer's, hopefully this year. And lastly, as the year ends, we've been engaging with Representative Kathy McMorris Rogers' office. She's been a longtime champion of our priorities in Congress and currently chairs the House Energy and Commerce Committee. We have a couple of bills being considered by this committee, and we hope that Kathy will greenlight a markup of those bills to get them moving closer to passage in Congress. So these are many of our biggest accomplishments from the past year. Next, I'd like to tell you a bit about those congressional priorities that we're working on this year. So now moving on from what we accomplished to what we hope to accomplish. Right off the bat, we have two very significant priorities to work across the finish line as soon as possible. The first of these is a bill to renew the National Alzheimer's Project Act, or NAPA, which was a bill initially passed back in 2015 to create the United States' first national plan to address Alzheimer's disease and to identify it as a public health crisis. The creation of this plan had all sorts of implications for our work in Congress and greased the wheels, if you will, for us to get a lot of good bills passed over the last 10 years for people with dementia and their caregivers. The goal, simply put, is to effectively prevent and treat Alzheimer's by 2025. Coincidentally, 2025 is the year that the original Project Act is set to expire, which is why we must urge Congress and President Biden to renew the National Alzheimer's Project Act in full. I'm sure you've all heard about the new Alzheimer's treatments that have been approved by the FDA recently. I've been talking about them kind of throughout this presentation. It's that kind of planning and lobbying that helps us make sure Congress is ready to step up in passing laws to support people affected by dementia, in part through things like increasing research funding, which I'll get onto here in the next slide. We're at what I would say is an especially significant moment with Alzheimer's research funding increases for the National Institutes of Health, or the NIH. Congress's investments in NIH research have in large part provided for this historic moment in treatment that we're all talking about today. From a research perspective, we're beginning to talk about really compelling ways to detect and prevent Alzheimer's, even delaying its progression in those who already have it. Our conversation around treatment today reflects this. We have ways to slow the progression of Alzheimer's down now, but only for those in the early stages. 2,000 people, we estimate, tragically, age out of that opportunity daily. This is an example of why we need to keep our foot on the gas with research in Congress and keep generating these kinds of research advancements. This year, we're lobbying for a full $321 million increase in research funding requested by the scientists at the National Institutes of Health. Next slide, please. We're asking Congress year over year, as I mentioned, to continue increasing the amount that they spend on dementia research. These are important relationships. They obviously take time to cultivate, and it's crucial that we see to it that these dollars are spent efficiently and transparently, that these members of Congress can trust that. So the next major priority of ours in Congress is the Alzheimer's Accountability and Investment Act, AAIA, which focuses on this exactly. When I described earlier the NIH scientists basically asking Congress for the money that they need, well, the congressional term for that is submitting a professional judgment budget. AAIA would require them to do that annually, making sure that appropriators wondering exactly what this money is being used for can have some good answers at the ready. And here I just want to include a visual that really helps to illustrate this. Forgive me because I used this slide last year, but I think it's really helpful. You can really see the kind of call and response relationship that I'm describing between Congress and those NIH scientists with our support. Congress allocates the funding, and a year or two later, a major landmark is achieved. This is exactly the kind of momentum, I keep saying it, that we need to keep going in Congress if we're going to keep best serving those living with dementia or subjective cognitive impairment and their caregivers. So the other funding increase that we're pursuing this year has to do with the Building Our Largest Dementia Infrastructure, or BOLD, Infrastructure for Alzheimer's Act. This act became law a few years ago, and fully funding it year over year is crucial to our broader mission to treat and prevent Alzheimer's effectively. It instructs the Centers for Disease Control to build a public health infrastructure to better support those affected by dementia through the means that you see described in this slide. So early detection, risk reduction, et cetera. And lastly, we are again looking to pass the Comprehensive Care for Alzheimer's Act, which instructs the Centers for Medicare and Medicaid Innovation to test a different payment structure when it comes to paying providers for things such as dementia care planning, care coordination, caregiver education. Too many of us on this call know the grim reality that can happen with an Alzheimer's diagnosis, where you essentially receive the diagnosis and then little to no support immediately afterwards. When it comes to changing this reality, we know that we'll need to carefully look at how Medicare and to a lesser extent Medicaid can be made better to improve the way providers are compensated for these services. So next, I'd like to talk a little bit about how you can get involved on this next slide. So this sums up our congressional work and priorities, and I definitely want to close here on a personal note about getting involved. My family's been through it over and over, as have many of yours. I know what it's like to feel powerless in the face of whatever it is that Alzheimer's is going to do to my family. We are changing the future of treatment in our work here today. You've seen that we have new treatments which can actually give people with Alzheimer's more time with their loved ones. We're hitting historic levels of research funding, and Congress is locked in tune with a national plan. This is a result of your work. There are so many people who made their own individual and historic contributions to get us to this point. So please, together, help us keep up the good work. Here are some more specifics on what that work looks like. We conduct email campaigns year-round. As I mentioned earlier, they're super easy. You just sign up to receive them and join the Alzheimer's advocates who contact their members about our congressional priorities on a regular basis. You can make phone calls to your congressional office, use social media, and just keep in mind that your story is what's most important. You don't have to be an expert on facts and statistics. You can follow the Alzheimer's Impact Movement and the Washington State chapter on social media. I've got them both right here. And the highest level of advocacy volunteering that we offer is work with an Alzheimer's congressional team. These are high-level volunteers who work directly with me to keep our relationships healthy with congressional offices. They're often on a first-name basis with staff and on occasion the members themselves. The work is fun. Each team is led by an ambassador who helps congressional team members practice sharing their stories and prep for successful meetings, town halls, etc. We're always looking for committed advocates to bring into these ranks. It's a really cool way to sort of pull back the curtain on our inner workings with Congress. And I just want to note that the average time commitment is very minimal. For regular volunteers, it's less than 1 hour per month. With that, I think I've used up all the time that I have, and I will turn it over to Brad. Thank you.
Well, thank you very much, Nick, for that very thorough update. We've got a lot of great stuff going on at the federal level, in no small part to all of our advocates. So if we can go to the next slide, I would now like to lead us into discussion of the work that the association is doing at the state level with our state agencies and our legislature to ensure that Washington State can best serve people living with dementia and their care partners. So I'd like to start by talking about the Dementia Action Collaborative, or DAC, which you may have heard of. The DAC is a work group that is co-chaired by the Alzheimer's Association and ALTSA. That's the state's Aging and Long-Term Support Administration. This group is tasked with updating and tracking the implementation of our state's Alzheimer's plan, which I'll touch on the next slide. We at the DAC also keep legislative and agency stakeholders informed on our progress through regular updates to our state's legislature and to the JLEC. And if you're not familiar with the JLEC, it is the Joint Legislative and Executive Committee on Planning for Aging and Disability Issues. And so you can see why we just call it JLEC, because that is quite a bureaucratic mouthful. But really what this is a committee made up of legislators, agency staff, and the governor's office who come together and work together year round to develop policies that affect older Washingtonians. And I'm very proud to say that at the DAC, we completed our first ever update of our Washington State Alzheimer's plan. This was a thorough, exhaustive 18-month process that included an assessment of the original plan, which is about 10 years old, to identify the work that had been done, what work from the original recommendations still needs to be done, and to determine if new needs in our communities have come up in those years since the plan was originally written. And this process included multiple public meetings to help identify needs on the ground in our communities in the 39 counties throughout Washington State. And I know that some of you on this webinar today took part in that public input stakeholder process. And to that, on behalf of the DAC, I want to say thank you for your input. You helped us to develop a thorough, thoughtful, updated state plan to address Alzheimer's disease and all of the dementia, and we could not have done it without you. Our updated plan uses a stronger evidence base for reducing potential risk factors for dementia, using new knowledge around brain health and the ways that brain health over a person's lifetime relates to dementia and dementia risk. It also includes a heightened emphasis on health equity, since people who are poorer and people of color tend to have higher instances of dementia. And ultimately, this updated plan builds on the foundational tools developed in our original plan. So if you would like to learn more about the specific recommendations in the plan, we will drop a link into the chat. It is some good reading. It is dozens of pages long and is, as I mentioned already, very thorough. And I want you to know that right now, the DAC subcommittees are currently prioritizing these recommendations. And we're going to work on the implementation of this new plan over the course of the next 5 years. And so it's important to prioritize which of these recommendations need to be done first, where is the most urgent need, which ones have already been started based on the old plan, et cetera. And so at our next public policy town hall, we'll have even more information about where those priorities landed and provide you with an update on how that implementation is going. And so the website link that will be in the chat will link you not only to the full plan if you would like to read it, but you can also check that website for progress reports as the year goes on as implementation gets underway. And lastly, the site also contains links to the dementia roadmap, which is a guide developed by the DAC for families and care partners of people undergoing the dementia journey. And so now I'd like to turn away from some of the state agency work and talk a little bit about the upcoming legislative session and some of the asks that we at the Alzheimer's Association will be making of our state legislature this year. So just to sort of set the stage a little bit, the legislative session will start on January 8th, and it will run for 60 calendar days, which includes weekends. This goes by very quickly. Most bills will only have a couple of weeks to get out of their original committees before they are considered dead for the year. And so it is a real sprint. And in the 60-day session, the legislature will develop what is known as a supplemental budget. In the odd number years, such as 2023, so earlier this year, the legislature passed a 2-year budget, which funds the state government operations for those 2 years. And then in the even number years, such as the legislative session that's coming up, the legislature passes what they call a supplemental budget with spending that supplements the budget, the larger budget that was passed the previous year. And so we are asking the legislature to include some specific funding in their supplemental budget, and I would like to tell you about that now. The first priority I would like to discuss with you is the expansion of the Dementia Friends program. So this program is currently funded at about $100,000 annually, and we are asking the legislature for a $50,000 increase to bring that to a total of $150,000 annually. The Dementia Friends program has long been a priority of the Dementia Action Collaborative, which is the group we discussed just a couple of slides ago, and we are more than happy to lead the way to support the expansion of the program. Dementia Friends is run through the UW's Memory and Brain Wellness Center, and is a program that provides public awareness and anti-stigma education to members of the broader community in specific regions. The Dementia Friends was originally a 3-county pilot, and because of association efforts to secure some initial funding, that was expanded out to 19 of Washington's 39 counties. And this additional funding will allow the program to continue its expansion to all corners of the state, reaching people in every county, many of which are currently underserved. If we can go to the next slide. Thank you. So our next ask is for $2.1 million in funding to expand guardianship services to vulnerable adults who need them the most. And that 2.1 million is a big number. So I'd like to break it down into 3 parts so you can have a clear idea of what this money will pay for and what we are requesting and how it will help people living with dementia. You can see in the first bullet point here that 1.5 million, so the lion's share of the 2.1, will go to expand the work of the Office of Public Guardianship. The Office of Public Guardianship is run through the Administrative Office of the Courts, and they provide guardianship and guardianship services to the most vulnerable people in our society who most often do not have anyone else to act as a guardian for them. And their clients are folks who oftentimes without a guardian cannot make decisions for themselves and end up stuck in acute care hospitals when they don't need to be in the hospital, but they aren't able to be placed into an appropriate long-term care setting without the support of a guardian. And so expanding the work of this office to take in more clients will not only help alleviate overcrowding crises in our hospitals, but it will ensure that people, including people with dementia, will receive the right care in the right setting. And then the second bullet point there you see is a ask for $500,000 for supported decision making. And so these are services that support people in making their own decisions. And so it allows people who may have limited capacity to work with a team of folks to help them make their own decisions, which not only allows people to maintain some autonomy and decision-making power, but also means that the folks that receive these services oftentimes don't need to go under a full guardianship, which gives them more autonomy and also saves money and capacity in the public guardianship system. And then lastly, we're asking for $100,000 to be appropriated for dementia training for professional guardians. Um, Certified professional guardians are required to get recertified every 2 years. And as a part of that, they need to engage in continuing education. And this funding will allow professional guardians to take dementia specific training free of charge. Oftentimes, the CEUs that professional guardians need in order to be recertified are courses that they must pay for out of their own pocket. And so by providing this funding, we'll give them the opportunity to take this continuing education free of charge. And this dementia training includes information on best practices regarding interactions with people with dementia, which will allow professional guardians to have the best possible relationships with their clients. And so how can you help? One of the things that you can do is to please save this date. We will be hosting our annual Advocacy Day in Olympia at the state capitol on January 31st. If you came to our Advocacy Day last year, we would love to have you back, and we're going to be doing a similar agenda to last time, where we will meet at a church across the street from the Capitol, and then we will all make our way over to the Capitol after a sort of morning educational session. So please save this date, and we're going to put a registration link in the chat. And if you go ahead and register, we'll get you all signed up, and then you will receive more information in your email as the date gets closer with more specific instructions. And then lastly, I want to touch on what is potentially the most important service that is provided by the Alzheimer's Association, which is that, if you need help, we want you to know that you're not alone. Please know that you're welcome to utilize our national helpline, which, as you can see on your screen there, the number is 1-800-272-3900. And this 24/7 helpline is staffed by social workers who can answer a great range of questions. Questions like, I see my uncle engaging in certain behaviors. Is this Alzheimer's? All the way to, my grandmother in Fort Wayne, Indiana needs to find an assisted living facility. How do I help her do that? And any question in between. Our operators are standing by to help 24/7, 365. So please do not hesitate to reach out if you or a loved one have any questions. And finally, I want to take a moment to thank all of you for being here. We really appreciate your interest in the association, as well as our federal and state public policy priorities. And so with that brings to a close my section on the state affairs. And so I think we can move on now to question and answer, and we'll get to as many of these as we can. So I'm going to pull up the list here, and then we can go through them. So we did get one question. Will a copy of the presentation slides be available? Yes, we can certainly email these out to you. We have all of your information if you signed up and registered, which is how you got the link to this meeting today. So yes, we can certainly send those out. And then we got another one. Is there work going on to assist families with the costs of dementia care in adult family homes and other care facilities? Some people with dementia are impossible to care for at home without the caregiving stress endangering the caregiver's health. Um, yeah, so I am part of a group um, of advocates that are working on a specific request that kind of begins to get at this issue. But at first, I want to acknowledge that this is a very real issue, and that long-term care is very expensive, and the efforts to address that are ongoing and are sort of long-term. But I want to just mention first that. There is a program for people in assisted living facilities that is called the Specialized Dementia Care Program. And this is a program for people on Medicaid who, if they are in a facility that has this program, they can receive enhanced services that are dementia specific. And I'm working with a group to raise funding for that program so that more people in assisted living facilities throughout the state can access this higher level of care. Um, and I do want to say though that if you have any concerns that are related specifically to your own situation, I would recommend very strongly that you call the helpline and talk to folks there who can give you some good advice on steps to take in your own life if the issue is more immediate. But thank you so much for asking that question. We also got a comment in the chat about the Dementia Legal Planning Toolkit, which is a true asset for legal planning. Yes, thank you for giving that a shout out. That is another product of the Dementia Action Collaborative. The Dementia Legal Planning Toolkit is great for families who need to do, who sort of need to get the ball rolling on legal planning as they engage in a dementia journey. And can you provide a bit more info on Dementia Friends? What does it look like and how is it implemented? So Dementia Friends is a train the trainer program, which is run through the University of Washington, where they provide this public awareness and anti-stigma curriculum and education to folks who then go out and deliver those educational programs in their own community. And then I see Lynn. Hi, Lynn, first of all. But secondly, Lynn Cordy just dropped into the chat Dementia Friends information about how it works and where in the state it's currently being implemented in which counties. And for those of you who don't know, Lynn is a staff person who helps out with the DAC. So thank you so much for all of your efforts. And then I got another question here from Peter Newbold, which is, will you provide advocacy training for rookies considering going to Advocacy Day? Many have never done this. Well, Peter, that is a great question. And the answer is yes. I mentioned when I was talking about Advocacy Day that we will have the group of folks who attend meet at a church, which is just across the street from the Capitol building, the morning of Advocacy Day. And the purpose of meeting in that church is to get everyone together so you can meet the other advocates. You can have a little bit of food and some coffee. And then I will lead us in a training on not only what are the priorities that we are talking about with legislators, but what are the best practices for talking about legislators? What can you expect out of a legislative meeting? What questions can you expect and things like that. So we will certainly provide all that information, and there'll be plenty of opportunity for you to ask questions and get clarification on what you can expect. I would really encourage everyone, if you are available on the 31st, to come to Advocacy Day. It is very fun and interesting, and you get to make a difference in the lives of people in Washington State. And I will say that I used to be legislative staff at the state capitol, and I still have very fond memories of meeting with Alzheimer's Association advocates on previous advocacy days, because it is just so meaningful when people from communities throughout the state come to the Capitol. Because if you are a member of the legislature or a staff person, you see the paid lobbyists all the time. But nothing hits home quite like talking to members of the community who are very, very strongly affected by the work that the legislature does. So I will certainly, yes, provide a good amount of training. And also I want you all to know that I'm fairly available. So if you want to come to Advocacy Day and you're unsure, we can set up a time to have a phone call ahead of time also. So yes, thank you for that question. And so I'm looking to see if there are any others. Let's see. One thing I do want to say before I don't see any other questions, but I do want to mention that if any of you are interested in advocacy, obviously I've been trying to sell Advocacy Day here, but if you're interested in participating, even as Nick said, just a few minutes a month, certainly reach out to Nick. We are very interested in helping you get your story and passion out to our elected officials at all levels of government. So feel free to reach out, and we will certainly be happy to connect you with opportunities that work for you. And so I am going to give it, let's see, just a second here to see if any other questions come in. I see Karen Merez makes a comment about how most folks at the Capitol have a connection to dementia, and that's very true. It is hard to find people that can't relate to some of the stories that we bring. And then Peter, there's one more question here. Isn't there a state surplus? Why can't we be simply given what we need from that? Are others trying to get those funds? So the state, so there's a thing called the revenue forecast. So first of all, thank you, Peter, for that question. There's a thing called the revenue forecast, which predicts how much revenue the state will bring in. And the revenue forecast for the next quarter predicts that the state will bring in a little bit more money, which is great. Anything that is a positive in terms of net income is fantastic. That being said, we are going to be advocating alongside people from every other interest that you can possibly imagine. There is an organization, just as a random example, there's an organization trying to get some money for the state to research the health effects of eating seaweed. And so we will be in the budget committee hearings alongside people with those kind of interests. And it's always kind of a battle to make your case for why our issues should bubble up to the top. And this is just another good time to pitch Advocacy Day, because the stories that our advocates bring to the state capitol are ones that really move the ball down the field on having our priorities be the ones that the state ends up funding. Because selfishly, I think we have very good priorities that serve people who are in need, and it's the right thing to do. So yeah, thank you for that question. Well, I don't at this point see any other questions coming in. Um, well, I want to say again, um, thank you all for your time to be here. We will follow up with an email that will include all of these slides so you can go through them at your leisure. And just remember that if you or your family need help, the helpline is always there for you. And if you have any other questions about public policy or our priorities or why are we doing this and not that, feel free to reach out to Nick and myself, and we will gladly set up a time to chat with you about the work that we're doing. But really, thank you again for being here, and I hope you all have a great evening. Thank you.